good morning, everyone. Welcome to our April Grand Rounds. My name is Kina. I will be your host for today. And just before we start, I'm going to go over a couple of things, just a little housekeeping. This presentation will be recorded and uploaded onto our Zoom. And if you are watching our videos, remember that there's an option for playback speed to either speed up or slow down the videos. And on Zoom, you may turn on closed captions during the presentation for subtitles. There's also a summary running that will present us with an entire summary of the presentation, and we will send that out to you guys as well. And with that, I would like to hand it off to our medical director, Dr. Pekia.
Thank you, Kina. Appreciate it. And thank you for your work in helping to set this up. And thank you to our speakers this morning. I'll introduce them in a minute. I am the Medical Director of Global Offsite Care and the Global Grand Rounds series. My day job, if you will, is as a trained family physician and geriatrician after a career in that in Greater Southern California, as well as some mission work over the years. I am now 3 years into the Director of Telemedicine at Western University of Health Sciences in Pomona, California, as well as Corvallis, Lebanon, Oregon. And also I've been medical director here for the past 3 years. So with that, I'd like to introduce our speakers. First, Dr. Maryam Othman, MD, MPH. She's an associate professor in the Office of Medical Education and Chief of Global Health in the Department of Population Health Sciences at College of Osteopathic Medicine of the Pacific Division of the Western University of Health Sciences. She's received her MD degree from the University of Baghdad, Iraq, and her MPH, Masters of Public Health from George Washington University in Washington, D.C., where she was a Fulbright scholar. Dr. Othman is the Director of Medical Education for WiRED International, a nonprofit volunteer-driven organization about which she'll be speaking today, along with our other guest. And this organization provides vital medical education to underserved communities in regions challenged by war, poverty, and dislocation. He's also a board member of the Claremont Canopy, a community of volunteers, a corporation that support people displaced by forced migration and serves as an ally and advocate to newly arrived refugees, empowering them to thrive in their new community. While in Iraq, Dr. Othman was a consultant advisor for the Iraqi Minister of Health and a medical officer of the International Organization for Migration during and after the war there. Dr. Gary Selnow is the WiRED founder and executive director of that organization. Dr. Selnow is a professor emeritus at San Francisco State University and is the co-author of 7 books and dozens of academic journal articles. Dr. Selnow was twice a Fulbright scholar and has lectured at universities throughout Europe. He coordinated a national communication program for White House Task Force and served as a research methodologist for the U.S. Information Agency. He's consulted with the U.S. Department of State and for NBC Television and the National Academy of Sciences. Dr. Selnow was a pilot and information officer for the U.S. Air Force and has also been a regular commentator on NPR's Marketplace program. Dr. Selnow was awarded the 2004 President's Medal at San Francisco State University and the UC Berkeley Public Health Award. He earned his bachelor's degree at Rutgers University and his master's and doctoral degrees at Michigan State University. So with that, welcome to our speakers. And Dr. Othman and Selnow, the floor is yours.
Thank you, Dr. Pekia. I appreciate it. Before I start, I just want to have a little word to all my brothers and sisters in Islam in the world and wish them a very happy Eid Mubarak. It's a day of celebration, and I want to wish our Mother Earth full recovery and peace. We will be talking about a very unique program that we have with WiRED International, Community Health Workers Training Program. And we will be first starting with a little background, a little history about WiRED International, and then jump into the Community Health Worker Training Program and wrap it up with the next steps. I want to start with a little my version of WiRED, the WiRED history. WiRED started or was born in 1997 after the war in the former Yugoslavia. Their mission at that time was to provide internet connection to schools and hospitals in those war-ravaged towns. Their mission evolved and they started to provide medical information and health education to underserved communities around the world. And that's where or when I was introduced to WiRED and met Gary in 2003 in Iraq after the war. And throughout the years, WiRED continued to assess the need of the communities they serve and to modify their programs accordingly. And with alignment with the World Health Organizations, we identified that the major problem was the lack of health services in the communities around the world. So we launched the Community Health Worker Training Program pre-pandemic, and it became a global resource in many countries. So this is my version of WiRED. Gary, do you want to also say something about the history?
Sure, I can fill in just a few gaps. But first, Eid Mubarak, Maryam, to you, and on this day of celebration. The only background I would sort of fill in is that we did get started in the former Yugoslavia as the war was ending in most places, although we were in Kosovo when the bombs were dropping. And so that was a challenging time for us. But what it did is demonstrate the need for some sort of link between the physicians and the nurses in these places that were challenged by isolation, largely because of war and because of poverty and so forth. And so we were then bringing in as much information as we could. And if you think back to the many years, the technology was not so advanced then, obviously. And we were initially bringing in floppy drives full of material, and most people in this audience won't remember what a floppy drive is. And then we advanced to CD-ROMs, which was an improvement, but not that much. And then we went up to flash drives. And the problem with those media are that they still required someone to get on a plane and carry this material over to the places that needed it. And then most recently, with the advances of internet technology, we now have come to the point where we release all of our material online, and people can put the material on their cell phones, on tablets, and on laptops. And so it's an instant delivery, which has made a huge difference in the kind of services that WiRED can provide the doctors, nurses, and other folks around the world. And I'll move on here, but I just want to mention that looking at the advance of technology where more and more people had cell phones in their pockets and where we could deliver material directly to those devices for ordinary people, WiRED decided that our usual way of providing information needed to shift. And what we did is focused all of our energy on the training of community health workers. And there's a cost advantage to that. While we can train one community health worker, that person then can reach out to others in the community and serve many people. In Kenya, where we have a very active program underway at the moment, as we do in other places, but Kenya is sort of a showpiece for us. We have 20 community health workers working in the western portion of Kenya, and they reach more than 10,000 people each month with basic clinical services as well as training programs. And so that's a remarkable ripple effect that we can enjoy by training people, a few people who then go out and work in very meaningful ways with folks in their population. And so that's all the background I can offer at this point, and I'll just follow Maryam's lead on this.
All right. So the community health workers is that ever since the 1980s, World Health Organization reported that there is a critical lack of healthcare in low-resource communities around the world. And that was due to the inability of healthcare systems to provide services, but as well as to the low supply of medical health. In fact, WHO estimates that by the year of 2030, there will be a shortfall of 10 million health workers. So WHO envisioned that community health workers could play a crucial part in providing first-stop healthcare to underserved populations. And in response to this dire need of healthcare workers, WiRED launched our first community health worker training program about 4 years or 5 years ago in Kenya, as Gary was mentioning. The curriculum was carefully designed and expertly developed by a team of 12 medical professionals. The program has expanded since to other countries, but continually to be updated and expanded to meet the specific needs of communities that are facing emerging diseases or other health challenges. Gary, do you want to mention something?
I think in a subsequent, in a slide coming up, we do have more on the training program. Maybe can we sort of shift our attention to this, Maryam? That's the only other thing I would add. So when we looked at how we developed this program, we looked at what the WHO required for community health workers, and we looked at a variety of other training tools available for health training in low resource regions. And we came up with what turns out to be a pretty successful program that we are eager to share with people in any location. And so we're preparing to do that. What we've done is, as I mentioned earlier, all of our programs can be downloaded to a device, to a cell phone. We have some wonderful volunteer ITs who have developed apps that enable people to do that very easily. Nothing that WiRED offers do we charge for. It's all free of charge, and we have independent people who provide funding for our programs, and we go out after grants like other NGOs, and that's how we fund it. But we never ask for anybody in the recipient countries to pay for anything, because that would really limit the number of people who could access this material. As Maryam had mentioned, our program is completely WHO compliant. But the one other thing that the WHO has insisted on is that the training be localized. They don't want people to be sent off-site, trained, and then, dispersed into other areas. They want local people to train local populations. And that makes very good sense. And so the challenge is, how do you take a program that has content designed for global audiences, and how do you localize it? And we'll talk about that in a minute. And it's a very important component of the program. And then we have a few other things we'll talk about in how we provide opportunities for specialization and then follow-up training as well. Maryam, you might want to talk a little bit about the curriculum.
Exactly. That's why I'm going to talk about the components of the curriculum. It comprises of 36 modules, as you can see here on the right side, that, as I said, are written by medical professionals, but are also peer-reviewed to ensure accuracy and relevance. The course is about 100 hours to be completed, and each community health worker must pass a final exam to be awarded the community health worker certificate. But we don't stop at granting the community health worker a certificate. We continue and require them to have or to earn a 50 credit each year in continuing medical education. The CME will reinforce their knowledge, provide them with updates on medical developments, and enable them to acquire new skills. The spectrum of the curriculum includes the anatomy, physiology, some infectious diseases, chronic diseases, medicine management, first aid, critical care. We also have health communication and health surveillance. All right, it's Gary.
Can you go back one second? Yeah, I would just like to note that the curriculum we're offering, it's a dynamic curriculum, which means that we're changing it when necessary, we're updating it as appropriate. And the most recent addition, and we think it's a significant one, is the first aid and critical care block. And let me just mention how that came about. Before that, we had a pretty good first aid section, and it was certainly adequate for the task. However, we recently have added and translated the entire curriculum into Ukrainian. And the reason for that is obvious. If you read the papers every day, you see the problems folks there face. One of the problems that doesn't always make it into the media is that the medical community just can't keep up with the need. And so it became clear to us that we needed to do something to see if we could help ordinary people in Ukraine deal with some conditions that they're facing. The WHO reports that Ukraine has a number of infectious diseases brewing for obvious reasons. They don't have adequate diets and exercise and and their healthcare is limited, meds are limited. And so we provided the training to them, but we also felt it was necessary to add a significant first aid and critical care block. And so one of our board members, Dr. Richard Carmona, who is a former Surgeon General of the United States, was able to put us in touch with the trainers in Ukraine who are using the U.S. military's corpsman training material. And we were able to convert that for community health worker applications. And so what we've done is we've added a significant block, not only for Ukraine, but now for all of our community health workers around the world. That has increased the number of training hours, but it's certainly appropriate. And all of our community health workers who have gone through the augmented training tell us that it has been very valuable in their daily work. So I offer this as an example of how WiRED keeps its finger to the pulse, on the pulse of the needs that health workers face in low resource regions. And we try to accommodate their needs by way of our training material, which again, we can make available in minutes by way of our distribution system. So anyway, that's all I would have to say about the curriculum, except to say that, thanks to Maryam, Dr. Othman, who has been extraordinary in monitoring this and in her review of the material and writing of the material. She's been spectacular, and I want to thank her for that. And note that as an academic, a lot of our work, and I've been in academics for a long time, as you heard in the beginning, a lot of our stuff we write and it's great and it sits on a library shelf and gets dust. When an academic writes for WiRED, it gets in the field immediately and it's distributed globally and it's used every day. And so I always make a pitch to academics who might look at WiRED and say, if you would like to help us out with your writing, your reviewing, and so forth, it's time well spent because it doesn't sit on a library shelf. It's out on the streets and out on the places in the world where it's really needed. So Maryam has sort of shined the light on all of this, and I want to thank her for that.
All right. Gary, do you want to talk about the deployments?
Sure. Once the community health workers earn their certificates, they're ready to go. And as Maryam mentioned, there's a rigorous final examination they have to pass. And once they have that certificate, they're ready to go in the field. And so how do we do that? It's important that WiRED always forms a partnership in the places we work. We never go in by ourselves and set up a shop with only our flag out front. We always partner with some local folks who know the area, who have a vested interest in the area. Sometimes it's a clinic or a university or another NGO that has some sort of a health focus. And so we partner with them, and they do a lot of the work on the ground. So WiRED supports the training, and we also help the local partner get funds by way of grants and so forth so that they can fund the deployment. One thing that the WHO insists on, and we agree, is that community health workers have to be paid. They can't be people who just volunteer 40 hours a week. It just doesn't work that way. You don't keep people very long doing that. And so they do have to get some sort of a stipend or a salary. And so the deployment does cost a little bit of money. Now, with that set up, the question is, how do they afford this? A lot of, in low resource places, they can't afford to put out 10 or 20 community health workers every day for 40 hours a week. So how do we do that? Well, WiRED has been exploring ways to save money. In other words, to institute a community health worker program, but not incur the huge costs that would be necessary to run a full-blown program. Nice to do that if you can, but not everybody can do that. So one way we found is the item number 2 here are the health screening clinics. And we weren't sure how that would work at the beginning, but we've tested it, and it's a remarkable advance for community health workers. And here's how it works. They set up a facility once a week or twice a month or at some frequency they can afford with about 5 community health workers. And so we have fewer people involved, and they don't launch every day out into the community, but they set up these shops once a week or twice a month, as I was saying. And they also bring a clinician along, someone who is licensed in the country, and he or she then goes with the community health workers. Sometimes we set up a tent. Sometimes we're in a school or a meeting hall, and we set up a facility. We announce it to the community, and then people come to that location sometimes just because they want to be screened, and sometimes because they have a health issue. And so we have a certain intake procedure that we follow in all the HSCs, where we'll have a few community health workers sitting at a table in the front. They log people in. We're using, in some places, Excel spreadsheets to build the database. In other places, it's still pencil and paper, but we're trying to upgrade all of them to an electronic way of keeping records. And then they take blood pressure and pulse oxygen, blood oxygen, blood sugar, and height and weight, and so forth. And what they'll do is find out if there are people who exceed the limits. They then send them over to the clinician for additional treatment if necessary. Also, if people show up and they have some ailments that they would like to have addressed, they then too go through the screening clinic and then over to the clinician. And it has worked very well. And so far we've been testing it for about 7 months in Kisumu, Kenya. And it has produced great results. It has saved a lot of money. And the reason money keeps coming into this, as I said, is that there are a lot of communities in other places that would love to have a community health worker program, but they can't afford the full-blown program. We're offering this health screening clinic as an alternative. We're saying don't drop the idea entirely. It's too valuable. Instead, set up the clinic, and let's see how that works. It costs you much less, and it enables you to get into a set of procedures that really can help the health of your community. And let's see, I think that covers most of it, Maryam. And you may have some other things you wanted to add to that.
Do you want to talk about we already talked about the partners with the local communities. So what I want to say is that it is a great program. I mean, I'm proud of being part of the people who designed it, but it's actually the thank you should go to the people on the ground who are implementing the program. And I thank Gary for, like, he always carry his backpack and go into the field to make sure that the truth and the final exams are being very secure, very accurate for all the community health workers to take it and to continue the effort. He will have numbers at the very end, probably 10,000 people that have already been reached out in that small town in Kenya. The CME program, as we mentioned, is a very important program in addition to the training. As I said, they were requiring 50 hours of topics for each community health worker to go over. Some of these topics could include mother and child health care. Others could include infectious disease prevention and care, non-communicable disease prevention and care, or any emerging diseases that happen within the community, say Lassa fever, just like what happened a couple of months ago, Ebola, Zika, COVID. All of these topics are being designed and implemented and added to the library for the community health workers to go over. The common denominator throughout all of WiRED's work is by educating the local people to become participants in their own healthcare. So WiRED community health worker training program teaches the community health worker how to elevate the communities to recognize signs and symptoms of diseases and to learn about how to adopt healthy behavior participants in their health. A majority of our modules have been translated to other languages because we serve in other countries like Spanish, French, Arabic, Armenian, and Ukrainian is the most recent language that's been translated. Gary, anything else?
Sure. I would use the library that's mentioned in this panel to stress 2 points. And one of them is the localization. And I mentioned that earlier, that the WHO requires localization of community health workers. And the first way we do that is to have, when they go through their basic training, it's a classroom exercise, 200 hours, as we had mentioned, but the classroom is taught by a local physician or a local nurse. They're the ones who know the restrictions of the local governments. They're the ones who know the resources available for health care and so forth in the community. They know the local profile of illnesses and so forth. And so what they can do in their classroom teaching is to help bring this global training program down to the local level. stressing those elements within that global program that are most relevant to the local audiences. The second localization is this CME program. And that is, we require all of our community health workers to get 50 credits a year. We let them select the topics from the 400 modules available. And so what they do typically is to select the topics that are relevant to their fieldwork. So, for instance, we mentioned, or Maryam just mentioned, Lassa fever, which is hitting West Africa at present. And so we've just finished the module. We're about to send that over. And they're the local community health workers who might not know anything about Lassa fever, can read up on it, can study it, put it on their cell phones, and then the next day go in the field with a full understanding of what Lassa fever is about, how it can be prevented, and how to treat it, and so forth. And that's just an example. And we do that for all of the areas. People, the local community health workers, localize their understanding based upon the illness profiles that they face every day. And that's very important. The one other thing I would mention, and that we're urging the community health workers to do this now. If you have a group of 5, 10, or even 20 community health workers, it's really good to have some specialists. And I want to put parentheses around that word. And specifically, every community health worker can't have a full understanding of every health topic, nor can any physician or nurse. But what we're encouraging the community health workers to do is to specialize in certain areas by loading up on certain topics. So, for instance, in Kenya, we see where there's a lot of need for information and for clinical care on mother and child health issues. And so several of the women in the group have specialized in mother and child health. In other words, they've read 20 or 25 modules we have on topics relevant to mother and child health. Meanwhile, someone else will specialize in, let's say, infectious diseases, or specialize just in cholera, which happens to be a real problem. And what happens is when the community health workers are out working, whether it's in a health screening clinic or just out deployed, and they come across cases that need someone who has a little special care in a particular area, they can call that other community health worker over. So if someone finds, there's a woman who is pregnant and she needs some additional attention, they can call in the mother and child health specialist, and similarly for other topics as well. So we're very big on this CME program. It's absolutely critical. The WHO requires it, but we would do that anyway. We really push this because we think that it helps to maintain the knowledge of our community health workers, but also advance their skills and makes the entire core of community health workers in any location even more concerned about the issues, but also have greater capacity in addressing the needs of local people.
All right, so we didn't mention that if you guys have any questions in the middle of the presentation, please feel free to unmute yourself or raise your hand and we will take those questions, but we can save them at the end. We have our next steps is what do we need the community health work training program for, is that we want to spread the word that this is a good program and it's needed in the ground. If this platform can help us spread that word, we are ready. WiRED is ready to just partner up with any community and launch the program. So we want to disseminate in the training in other areas around the world. Updating the modules, it's always happening. Like whenever there is a need, we are there. We are updating as in a minute. It's written, it's published, it's translated, and it's published, and it's ready to go. We want to focus. Our next focus is the One Health concept, which is include the human, environment, and the animals. We want to add a lot of topics related to that because many of our population in the communities have domestic animals related to them, and they live like in Kenya. I have work with community in Kenya near the safari where they have also the wild animals surrounding them. So there is an intimate connection between the animals, humans, and environment had a lot of impact on our health in general. And we want to also include, it's coming, we're working on it, include the One Health concept into our library. Gary, do you want to take over?
I think, thank you for that profile, because I think that was exactly what I would have said, Maryam. I would only add that we're just trying to get out the word about the program. COVID has interfered with just about everything on planet Earth in the past few years. It interfered a little bit with the expansion of this community health worker program that we anticipated at the beginning. But we're now rolling this out more actively, and we would certainly appreciate anybody who could spread the word to places you work in low resource regions where they might benefit from a community health worker program. Let us know about this. Let them know about this, and put us in touch, because we'll be able to help them maybe set one up, or at least to explore the possibility. And I would underscore that we don't charge again. We're all volunteer, and so that keeps our costs down. And it gives us a lot of flexibility. At the beginning, 27 years ago, people said you could never run an organization without paying paid staff. But we've demonstrated that's not the case, and we have had wonderful volunteers over the years. And because of their generosity of time and their talents, we've been able to run this program, and so we can offer it without cost to people overseas. We're always looking for medical students and for nursing students and others with a medical background to help us keep our material current and adding new material, as Maryam said. And that's a very important component of this. Global health and One Health is really important. We had planned to roll that out 3 or 4 years ago. COVID got in the way there in particular. But now we're adding extra effort to that program, and we hope to have several modules on One Health. I personally have a very strong interest in this area, but also the organization does. And so we're pressing on this. We have some veterinarians who have joined us, and so we are eager to roll that out. And finally, number 5 is pretty important, because what we'd like to do is let the physicians and nurses in these regions know about this program. We're not offering community health workers to step in and take over from physicians. Far from that. The doctors and nurses are far better trained. What we're doing is working with a group of people whose role in public health is to assist the doctors and the nurses. And so they'll do a lot of the screening. In Kenya, there's been an issue with respiratory illness and with hypertension in the schools. And in fact, there have been 2 articles about it recently in the Lancet. And what the community health workers are doing is going into the schools, taking blood pressure, they're taking the blood oxygen ratings levels. And then for the young people, for the kids who might be exceeding the limits, they're then mentioning that they visit the local physician and so forth. But these are the kinds of things that doctors and nurses just don't have time for, but that community health workers can step in to take care of, and to really extend the reach and increase the impact of the medical community in low resource regions. So that's another thing we would really benefit from, that the program would benefit from, is letting the physicians and nurses know that community health workers are there to assist them, to supplement their work. I think we've pretty much said it all, Maryam, and we're very excited about this community health worker program. We really think that the whole concept that was initially designed by the WHO, and the way we have taken it into the field, and we've sort of given it legs. We think that it can make major contributions in places where health is becoming an increasing problem, as the number of physicians and nurses is not keeping up with the growth in population, where the world is facing other problems with infectious diseases and even hunger and starvation, which precipitate other issues. We think this is a program that can really help. And we're doing it, all the volunteers at WiRED, including Maryam and me, we're doing it because we want to do it. And we think that it can help people. We're not doing it to get rich, because, as we said, we're not getting paid. But the people are in this for valid reasons. And we hope that everyone who looks at this video or is sitting in on this Zoom, if you think we can help any of the audiences you serve, please let us know, because we're eager to pitch in where we can.
Yeah, and we thank everybody for your listening, and we're ready to take any questions. Thank you all.
Thank you very much, Doctor and the presenters. I am Shembi Tabita. I really want to appreciate you for the great work you are doing. By profession, I'm a nurse working with Federal Medical Center, Yenegua, Bayelsa State in the southern part of Nigeria. Your program is a very good program that will really help, especially here in Nigeria, where we are ravaged with Lassa fever, hunger, and all that. So it's a very good program, and it is coming at the right time. And I want to assure you that our nurses and our doctor will gladly key in when the opportunity comes. I want to commend you for the good work and the sacrifices you are giving to make sure mankind is safe on planet Earth. May God reward you and strengthen you more and more. Thank you.
Can I say something, Tabitha? If we can somehow get connected by email, I would like to stay in touch with you because we are just launching that program in Nigeria, as I mentioned at the beginning of this session. And we're working with a local volunteer NGO, and we would like to involve as many medical professionals in Nigeria as we can. So maybe if we stayed in touch, we would be able to get involved in advancing that program.
Okay, sir, that would be good. Maybe I will just place my email address on the chat group here now.
Okay.
And I would copy it and send it to you, Gary. Thank you.
Okay, great. Thanks, Maryam.
Thank you, Tabitha.
Again, thank you for that presentation, and very informative, and congratulations on the progress you've made over the years, and also so interesting to hear your success with the CHW, the Community Health Worker Program. Our experience from Global Offsite Care has been that I guess you would call that one of the missing links of effect outreach to underserved communities around the world, trying to overcome the many barriers to accomplishing that. And that brings to mind a couple of questions. So I'll pose my questions while the remainder of the audience formulates any that they may have. And first and foremost, I did wonder, does the WHO compliant curriculum that you use address training in skill sets pertinent to telehealth platforms, how to manage those, the hardware, the software, et cetera, from the user side, the community health worker side, and also the skills of managing telemedicine encounters? Is there content in the curriculum specific to that? And if not, how might that be?
Maryam, I'll attempt an answer. There's a very simple answer, and it's no. And the reason is we don't have the back end to that. In other words, there isn't the mechanism or the programs available for them to tap into in order to engage in telemedicine activities. Now, if that were to become available, then we would certainly provide training in that. But it would be, at this point, it wouldn't be very productive to have us train them in something they couldn't implement. So we're open to the telemedicine activities, but at present, we just don't know of any, and we don't have the capacity ourselves to set one up.
Okay, great. Okay, good to know that. And I think in the spirit of cooperation, right, perhaps a dialogue in the not too distant future about how Global Offsite might be able to help build that bridge and co-manage that process. So another question that I have is, what type of platform is utilized for the continuing medical education component, WiRED International's mission? And is that CME, beyond the education and CME management of your community health workers, does that involve licensed clinicians at any point as well? Where is that line drawn, or is there actually a separation of the CME of the CHWs, community health workers, and those that they're assisting, nurses, mid-level physician assistants, nurse practitioners, physicians?
Here's the way we operate this. We make that available. When I say that, the library. So the library is the 400 topics, and that's it's always growing. It's a requirement for our community health workers. So they have to have 50 credits a year. And as I was saying before, and they can select the profile of topics they choose and so forth. That's up to them. However, that library is available to everyone. And so we let the physicians and the nurses and the pharmacists and the other folks engaged in health practices in these communities, let them know it's available for them as well. Now, they don't engage they don't have to earn 50 credits or any of that. It's just a library for their use. And they do use it. And we know that medical students as well in Kenya are using this in particular. So we really see two categories of audience. One who are really nudged into doing it because it's part of their certification from WiRED, and the others are welcome to use it because it's a really good library with relevant material that's been peer reviewed and all of that. So there's really the two audiences. And I think that's what you're asking, but if I missed it, let me know.
No, absolutely. Thank you.
Can I say one other thing? A quick comment on the structure of the modules. We did a lot of work on learning theory, on good learning theory when we set up the structure for them. And the technique we use is to provide several key concepts, and then we have Q&A. Several key concepts, Q&A. And we repeat that pattern throughout the module, and it ends with a large final exam. That it's not, I mean, it is graded, but we don't care about that. It's really there as a reinforcement tool. And so good learning theory says that if you can present somebody with an idea and then test them on it right away, it really helps them to learn it. And that has proven itself to be remarkably effective over time. So whether you have a physician who is using the module or you have a brand new community health worker, it really does help the learning process to use that pattern.
Great. Thank you for clarifying that. And yeah, we know from our experience at Global Offsite, that's a lot of work. That's quite the challenge to manage initial and ongoing education of any healthcare worker at whatever level they may be contributing to the effort. So, congratulations on your success there. A question actually involving medical students and other healthcare professionals in training. Thinking of them as a potential unlocked resource and the potential for a win-win, if you will, especially leveraging telemedicine and the capability of medical students and other healthcare professionals in training around the globe to be able to contribute to the effort, if you will, to support the community health workers in a way that is, automated or facilitated by the kind of communications technologies that we're using as we speak here. So, Dr. Othman, how does that work so far? And successes or challenges that you face in the involvement of medical students and other healthcare professionals in training.
Yeah, that we have the global health track at Western University, and we also have the global health club. These are students who are interested in the global health. So what I do with the global health track, for example, we have that capstone project at the end of their second years when they complete the curriculum of the global health. It's an option, of course. It's not we can't require them to do that, but I give them the option of writing a module to go and do a research based on their interest in the residency that they want to pursue when they graduate. So if they see certain topic that is needed, specifically right now we are focusing on the first aid pocket guide. What happens at home? What do we do if something happened at home? So students go and do a research related to that topic, and they start writing under my supervision. They complete it, they send me the document, and I review it. Once it's done from my end, I send it to Gary to go through the pipeline of peer reviewing and the process of publishing the document itself. So it's a research as well as a health education. It's mostly for medical students. We focus on the language that is geared towards the grassroots level of people. It's not the medical professionals, for example. So we tend to avoid the use of technical terms. It's helpful in the sense that it's a health education, but also help them in like in the future when they start talking to patients. They need to learn how to manage a patient with the language, like how to address the patients when they have that patient encounter. That's the way I encourage them to, for publication, for research, as well as for their own benefits in the future.
Great. Thank you for clarifying that. And, further concepting about how to benefit our students and also practicing clinicians and, kind-hearted individuals to either support NGOs like yours and ours to make the world a better place, if you will. Drilling down to some of the specifics, the local challenges of delivering care and assisting the community health workers that you already have in place, and thinking through the intersection of the capabilities of telemedicine to actually help complete the loop of care for certain conditions that lend themselves to that. So that said, we have a few students here with us today, medical students, who, are headed towards specialties that lend themselves to telemedicine assist, essentially bringing the capability to the patient, keeping the patient in place with their community health worker in their local community, and to bring expertise to them. So my question is, would specialties like dermatology, skin conditions, and mental health issues, supported perhaps by psychiatrists in training or academic programs that maybe are potentially more able to be available either asynchronously or synchronously via telemedicine, would those types of resources be helpful to your program?
I have a few thoughts about that, Maryam. I don't want to step in if you might have. I think there are two things that I see specifically in terms of, let's say, patient assistance for telemedicine. We would always want to be very careful to bring the local medical community into that equation. It becomes political in part because we don't want to be circumventing the authority and the responsibility of the local medical community. At least we'd want to get their buy-in, even if they didn't need to participate. At least let them know what we're doing and sign off on it. Otherwise, it could make a lot of long-term political trouble, and we certainly don't want to do that. But I see a need for it, and we certainly would like to explore the possibility so that if we made proper arrangements, we might be able to set something up. But again, I just wanted to be sure that we involved not just the community health workers, but a larger environment in which they serve. The second thought I had, once a week, our community health workers get together for an hour and a half, usually on a Friday or sometime, and they'll have coffee or something, and they'll just talk about the week and talk about the things that are going on. That might not be a bad time for some sort of a live lecture of some kind, or it doesn't have to be a formal lecture, but just a discussion. So if the health workers are facing a cholera outbreak, yes, they have the modules, and yes, they have local doctors who are aware of it. But if a medical student in the United States or a physician in the United States had a particular expertise here, just to talk about it, to talk about their concerns and maybe about some of the things they're seeing that are not typical in terms of, the patients, the issues the patients are facing. And so again, just to quick summarize, one, it would be helpful to have that one-on-one patient referral or patient involvement. But the second thing would be some sort of a presentation. We could set up a Zoom and talk to the group, talk to the 15 or 20 community health workers all at once, or do a Q&A session or something like that. That would be hugely helpful.
Great. Yeah, thank you for that and for that detail. In fact, just as an FYI, I mentioned to the group at our last meeting, Global Offsite Care is approaching, final release of our version of the relationship with a group called Figure One, Figure, and then the Roman numeral 1. You can find it at the .com, and that is a platform that's designed specifically to collaborate in the way that you mentioned, an asynchronous meeting place, if you will, kind of like morning grand rounds in an academic medical center environment, except not tied to a particular meeting time or place, and fully virtualized, but also, built with tools that are easy for any user to post a case into a private space, or those who agree that that is a place to communicate regarding everything from patient care issues, fully de-identified, which is certainly important everywhere for confidentiality and security of any kind of information that's patient specific, as well as, talking about logistical issues, right? Challenges, many of which you mentioned, in this meeting. So lots of light bulbs going on here during your presentation, and, excited to talk more about how to kind of work together in a mutually beneficial way. So, okay, well, we're approaching the end of our session, and any other questions or comments or concerns in the few minutes that we have?
Let me just say one final thing. I would welcome the input of everyone in this audience, or anyone in this audience, people who did have an interest in global health and saw that their talents would lended to this or loaned to this operation. We would certainly welcome that. As I said, we're all volunteers, and we really found that putting our shoulders to the cart on this really has payoff overseas in so many places. And we're dealing with folks who don't have other resources. They don't have access to doctors on a regular basis, or certainly hospitals. If they can even reach a clinic under dire conditions, that's pretty spectacular for so many people. So what we're trying to do is have that last mile covered here. And anything you could do applying your talents to this, we would certainly welcome. And in an academic sense, people, publishing is important. Well, writing an article or writing a module would be pretty important, and it's peer reviewed. And if your institution accepted that as an academic contribution, we would certainly stand behind that. So thank you to anyone in the audience who thought that they had something to offer the larger global community.
And Gary, I have added your email address, and I'm going to add my email address in case they also wanted to reach out to me.
Okay, using my WiRED address?
Yes, sir.
Thank you.
Right. Well, we've reached the end of our time, and thank you again to our speakers, and appreciate that super informative presentation, and of course, the good work that you've been doing in these resource-challenged environments for so many years. So with that, I will hand it back to Kina, and she will close with any other specific details. And again, appreciate everyone who attended today. Feel free to share the opportunity for the recorded version of this with your colleagues and other interested friends in this topic. So Kina, the floor is yours.
Thank you, Dr. P, and thank you so much to the presenters for this informative presentation and this amazing program. Our Global Grand Rounds will be uploaded to our YouTube channel in a couple of days, and you may watch it. And just a reminder that our playbacks, there is an option to click on the playback speed to either speed up or slow down the presentation as you wish. And as Dr. P mentioned, I have a link to Figure 1 in the chat box. And if you would like to present, there's another link that you can reach out to us through email. And the Figure 1, if the link doesn't work, it's just figure1.com. And that should take you to the website itself. Well, that being said, our next Global Grand Rounds will be on May 8th, and we hope to see you there. Thank you all, and have an amazing rest of your day.